I'm really here to tell a story. So I spent the summer of 2007 at a rural hospital in Nesbit, Malawi. And this hospital has 2 doctors attending to about 250,000 people. And these patients are spread 100 miles in every direction. So you literally have patients walking 60, 80, 100 miles to access healthcare. And they were really trying to decentralize care. And they had turned and recruited a network of about 500 volunteer community health workers. These are basically citizens who've stepped up and said, I want some basic training, I want a basic drug kit, and I want to care for my community members. I was told that there were 500 of them. I spent 6 weeks at the hospital, and I only met one of them. And he's in the middle here. His name's Dixon. And he always carried this notebook around with him. It was wrapped in newspaper, and it was obviously very important to him. One day, sort of curiosity got the best of me. I asked him what he had. He opened it up, and there were these beautiful, absolutely gorgeous, handwritten drug adherence charts for about 25 HIV-positive patients that he was checking in on. And Dixon was walking 30 miles to the hospital every couple of days just so a nurse there could initial at the bottom of each page that he was doing his volunteer work and to check in on the patient statuses. So it was very clear that these community health workers were just as disconnected as the patients from the clinic and its resources. And there were tools to help. As Andrew mentioned, I met Ken Banks, and he was developing FrontlineSMS, which is a free and open source software platform that lets you coordinate large amounts of incoming and outgoing text messages. And it made a lot of sense to apply it to healthcare. So I bought 100 phones at $10 a pop, a laptop, and a flight back to the hospital. We trained the community health workers to text message, gave them solar panels, took it off the grid, mapped where the phones had been distributed, and all of a sudden, these remote community health workers were connected to the hospital and its resources. This man sitting down was epileptic. He had fallen into a fire and developed a pretty bad ulcer on his left heel. His community health worker, Pascalie, who lived 2 doors down, texted into the hospital to let us know what happened. And Alex, who's the home-based care nurse, and I jumped on the back of the one free motorcycle, took a bag of drugs, and got out 60 miles to see this patient. In 6 months, Alex responded to 130 of these requests and saw patients who would never have received care. At the same time, the hospital shifted all of their follow-ups to SMS and actually saved about 2,100 hours of travel and work time and a couple $1,000s in fuel costs. They were receiving this flood of patient updates and adherence reports, about 2,000 of them in 6 months. So this was really exciting, but it was clear there was a bigger problem, that other hospitals were facing similar challenges, that doctors were being stretched thin. Here you see areas in orange, dark orange, are places where we're seeing a critical shortage of healthcare workers, about 4.5 million worldwide. So doctors are being stretched thin, community health workers are being trained, and hospitals are facing similar challenges. I met Lucky and Isaac and Nadeem, really committed, brilliant people who care. And we co-founded a nonprofit organization called FrontlineSMS Medic. And at Medic, we're trying to develop tools to help these clinics. And at the same time, we're trying to implement and scale what we know works. And we need your help. I have a quick question. How many of you have an old cell phone at home? One hand up. If you have 2 old cell phones at home, put 2 up. Okay, that's a lot. So turns out you're not alone. And thanks to Chris for this picture. We are discarding about 500,000 phones every single day in the United States. And we know that community health workers need phones. We hear from clinics all over the world. So we launched Hope Phones, which is a recycling program here in the United States. Basically what we're doing, we're recycling phones here, taking the value of those phones, and using them to buy appropriate new phones for community health workers in Mali, Malawi, India, Bangladesh, and here in the US. So that's the cycle. Basically what we're offering is a way for you to give your old phone a new life on the front line of global health. If we were able to recycle just 1% of discarded phones here in the US for 1 year, we could provide 1 million community health workers with cell phones. Pair that with the technology and the partnerships we're developing at FrontlineSMS Medic, and I get a little choked up. We could provide better healthcare, help clinics provide better healthcare for more than 50 million people. Those are really big numbers, but we can do it. We talked yesterday about small, concrete steps we could each take to enact big change. So I'm standing here asking you to recycle your old phone and help health workers save lives. Thanks.
Very good.